Hello, and welcome to the Thyroid Warrior podcast. I'm Ebony, and I'm here as your wellness facilitator. I'm going to be sharing my experiences in managing Hashimoto's disease. I really hope that it'll help you on your personal journey. Keep in mind, however, this does not substitute for medical advice. It is only for your information and motivational purposes only. Now, let's get started. Hey everyone, so excited to continue the conversation, and this week we are talking about part 2. So in terms of being an advocate for yourself, what are some of the things that you can do? And this week I want to focus on 2 things: your tone when you're speaking, but also understanding the fact that you have a choice in terms of who you see. So the first things first is your tone. So a lot of times people often misconstrue our tones when we're speaking. And for me personally, I am a very silly person. I unfortunately have to code shift a lot or code switch depending on the vernacular that you use in terms of when I'm very professional and when I'm very silly and around friends. Typically when I present, I am very professional. I don't smile a lot. My voice gets deeper. And I have to make sure that the people that I'm presenting to hear me and they don't think that I am speaking in questions. So the reason why I'm telling you about your tone is A, you want to make sure that you're conveying the message that you need to convey, and that is you have people that understand that you're very serious when you're having that conversation with them and you want to be able to get your point across. But you also want to make sure that when you are speaking in terms of sharing your story, speaking about your diagnosis and your history, your principal problems, and all of these things, you want to make sure that you're not talking in a question-like tone like this, because if you're talking like this, and the tone of your voice gets higher, it makes it difficult from a provider perspective to give you that respect in some cases. And I'm saying this because I've had it happen to me many, many times. And I've also had, from a provider perspective, I've been told, will you just get to the point already? Or I can't tell if you're asking me a question or if you're actually telling me something. And I'm not going to lie, I was taken aback in many, many cases, in many situations, and I did not like that. So the unfortunate thing is at the time, I didn't have anyone to tell me that you have to be very direct in your tone, and you also have to be very factual when you're presenting information, because a lot of times, while there are some amazing doctors and healthcare providers out there, they also speak with their head and not necessarily their heart. So they want to know, what are those hard and fast facts? What are your symptoms? When's the last time you exhibited these things? How long have you been having these feelings? When did the pain start? The who, what, when, where, and how questions that we're typically taught in terms of presenting information in a report, a lot of times that's what you want to make sure you're sharing when you're speaking with a provider or someone on your care team. And when you come in confident, so taking that information that I talked about last week in terms of preparing your patient story, practicing it with someone, and making sure that you're crystal clear in your messaging, that's also going to help you convey exactly what you need your healthcare provider to understand. So as a result of practicing your patient story and being very clear in your communication, you're going to be able to get that respect that you deserve as a patient, because when that happens, you're also considered a good historian. So that's part 1. Part 2 is I brought up talking about tone first because What's really important is that when you're presenting yourself in a very professional manner, and when you're also clear and succinct in the things that you need from your clinician, if they're not giving that to you, you have a choice to ask to be seen by someone else. And I'll give you an example of me and the dentist. So I have not had success with teeth. I was not raised to brush my teeth multiple times a day. I was not raised to eat a lot of healthy foods. Like, I was on the standard American diet plus a whole bunch of soul food and fried foods and sugary drinks and pop and all that stuff. I don't blame my parents. They did the best that they could. But as a result, I did not have the best dental hygiene growing up. So I would go to the dentist and I would just go through the motions, get the cavities filled, never really change my behavior until I got older. And once I got older, I got wiser. I learned more about adequate oral hygiene, and I started doing a lot more to make sure that I was taking care of myself. And that naturally flowed to my teeth as well. And I remember going to a particular dentist's office when I arrived in Virginia, and one of the things that he said to me, I remember I had to get a root canal when I first got here, and I had a lot of complications with it, and they just put the crown back on, but I noticed that it wasn't in direct contact with my gum line. And I remember I would bring it up and I would say, hey, like, this is a problem. What's going on with this particular crown? Like, it's not sitting right. And they were like, oh, no, it's no problem. It's no problem. That's fine. You had significant decay there. Everything's okay. Then I started flossing, and I know the smell of tooth decay. I just do. That is my experience, because I did not have dentists that listened to me. And personally, I have a lot of anxiety around the dentist because of my ill treatment for so long. So for me, I am super succinct and super direct when I go to the dentist. I have my history. I have documentation of what's gone on with my teeth. Therefore, don't come at me with nothing less than exceptional patient care. And I'll never forget when I told the dentist, I said, I really think I need to get this crown replaced. His statement to me was, well, maybe I could just do a build-up because it costs so much money, and I'm just trying to be considerate of you, and you might not have a lot to get this done. And I remember looking at him, and before I could even think, I said, don't worry about me, my money, or my pockets. Fix my teeth. That's all I care about for you right now. Don't worry about whether or not I can afford a crown. And this is just another instance of just healthcare disparities, because I'm like, you would never ask another type of patient if they can afford a crown. I also went to the dentist in Old Town, Alexandria, Virginia. So I guess it was weird for me to be going to that type of office or practice. I don't know, but I was annoyed, and it was very safe to say that I did not continue with that particular dentist. And I pointed that out. I said, I don't appreciate being made to feel like I can't afford to get my teeth fixed. That's not your concern. That's not your worry. And that's not your issue. I have a choice in terms of who I see and where I go. Shortly after that, I politely found another dentist, and you guys know what happened? I had a horrible infection. My tooth, or what was left of it underneath, had decayed so bad that they had to cut into my gum line. And thank God I didn't need to get an implant, because that was bad. And even during COVID, right now in this time, I needed a root canal. I had moved from Virginia to Maryland a little while ago, and I have Invisalign. If you follow me on social media at Joyful Ebony, you've seen some of my stories in which I talk about a lot of those discomforts. But another issue is I went to a new dentist here. I'm a new patient. Typically, when you go to the dentist, you get x-rays, you have an exam, you get all these things done. And I remember not having x-rays done. And I said, why did you not take x-rays? They're like, oh, if you could just send it from the last office. And I was already annoyed because I had to wait a long time. I don't wait when it comes to the doctor. If I have to wait longer than 15 to 20 minutes, I'm not coming back. I'm just not. Because again, I have a choice. And what I learned in that particular scenario is that I needed a root canal. And had that office actually done the x-ray, we would have been able to have caught the infection that I had, because by the time I got to the dentist to contact my orthodontist, what I thought was a canker sore was actually an abscess that was draining into my mouth. And I know it's gross. I know it's disgusting. And when I got to the endodontist, he said, didn't that not taste good? And I said, honestly, I brush my teeth 5 to 6 times a day. So I didn't really have a lot of time to really taste anything. But I was so livid because that delayed my treatment with Invisalign for 3 weeks. And I was bounced back and forth, and that dentist office didn't believe that there was a problem. And I know because when I was talking to them, they're like, are you experiencing pain? Is this what? I was like, no, I don't really know. I'm not really sure. I don't feel pain, but something's not right. And I know it. Like in that moment when I was asking those questions and speaking that way, because I really and truly didn't know what was going on, I was not taken seriously. But once I got to the point where I was honestly just pissed off and tired of being bounced around, I was very direct. I said, look, I don't have time for this. Someone needs to stop, have me take a picture, or have me come into the office to get an x-ray. I'm not doing this anymore. And you hate to have to be that way, but sometimes you have to make it known that, again, you're a patient and you matter. And that's why clinicians go into care or healthcare or whatever particular specialty that they want to go into. And that's because they want to take care of patients. That's why they sign that oath. And when you as a patient don't feel like you're heard or you're cared about or you're supported, yeah, you're going to get angry and you're going to get upset. But what I want to tell you and share with you is that you always have a choice. And I never want you to forget that. So the key takeaways from this episode are I want you to practice being confident and assertive. And I know it's hard sometimes when you feel like you've been beat down and you're just tired and you just want someone that cares. I get it. But I want to arm you with the tools and the knowledge so that you don't get tossed around and you can go in and be confident in knowing that you know what you know about your body so that you can get really good care. And the other thing is knowing that you have a choice. You don't have to stop at the first clinician that you see. And I understand that for a lot of people, you have an HMO or you're tired of paying out of pocket, but you're actually in an even better situation when you pay out of pocket because, again, you have that choice. And I want you guys to know that you can get a second opinion. Sometimes you can get a third opinion. But when you feel like you go to that doctor and you've practiced your patient story and you know that you know what you know and you've been able to articulate that and your doctor still doesn't hear you, pick someone else. And I'll share with you one additional story, and that's about my mom and her primary care. I told her a long time ago she needs to break up with her doctor. Her wait times are horrific. They're between 2 and 3 hours sometimes. The doctor barely examines her when she goes, and she oftentimes leaves with more questions than what she got answered. And I said it's not okay. Like, she's a high risk patient, she has a chronic illness, and she has to be taken care of. So when you think about all of the things that I've said in today's episode, ask yourself this question. Based upon someone that you really, really love and care about, would you want them to go through hell, basically, when they're trying to get a problem resolved? Would you want them to have to suffer and go through unnecessary pain? Ask yourself, would you want that for someone that you love and you care about? Or would you want your child to be in pain or suffer? And if your answer is no, I want you to take a mirror and flip it to yourself and tell yourself, I don't want you to be in pain. I don't want you to have to go through this. So I want you to use that as additional fuel to push yourself forward in order to make sure that you're advocating for yourself. So with that, for today, you're going to have another checklist. So you can go to joyfulebony.com/checklist2 so that you'll be able to pick up that document that has these 2 points on it so that you'll be able to build your arsenal in terms of how you approach your care. And with that, take care. Okay, thyroid warriors, get out there and take things one step at a time. Remember, be great, reflect on your triumphs, and as always, be well. Take care.